A very warm welcome to all of you. We are here to unveil a report that promises to reshape the landscape of prosthetics and orthotic workforce here in the United Kingdom. This report represents the culmination of extensive research and effort, and more importantly, a shared commitment from all stakeholders, including the health services, industry, and higher education institutions. The support we had while completing this report is a testament to the power of collaboration and innovation in healthcare. With this report today, we are not only presenting the findings and strategies, but we are also paving the way for a future where individuals relying on prosthetic and orthotic solutions receive the highest quality care wherever possible. Thank you all for being here and for being a part of this transformative moment. Let's move forward together with enthusiasm and purpose in our shared mission to enhance our service provision. On that note, I'd like to introduce the Chair of the British Association of Prosthetists and Orthotists, Peter Iliff.
Hello and welcome everyone. It's my pleasure as the Chair of the British Association of Prosthetists and Orthotists to release this important workforce report. The landmark study provides critical insights into the current state and future needs of the prosthetic and orthotic profession in the UK. I want to first thank the research team at the Centre for Biomechanics and Rehabilitation Technologies at Staffordshire University for groundbreaking work with findings that reveal clearly a deficit within the P&O workforce, both clinically and technically. By WHO standards, we need between 142 and 477 additional prosthetists and orthotists, with over 1,000 more technician and support workers required. This shortage is something we need to address quickly and effectively, especially as our demand for prosthetic and orthotic care will only increase in the coming years as our ageing population. Already, employers are struggling to recruit qualified staff, with some existing professionals considering leaving the field, indicating a lack of career progression and challenges in their work-life balance. This report is a resounding call to action. It highlights key knowledge and skill gaps that we must fill through expanding our education programs. It points to new roles, like advanced clinical practitioners and consultant posts, roles that will help meet rising demand and encourage greater collaboration across the NHS public, private and academic sectors to grow and sustain our workforce and deliver the care required by our population. At BAPO, we're absolutely committed to implementing these recommendations in this report. We'll put forward strategies to increase pre-registration placements, to provide continuous new professional development opportunities, and enable prosthetics and orthotics to be an attractive long-term career choice in all four of our nations. Our patients deserve nothing less. In closing, I'd like to thank NHS England and all partner organisations for supporting this study. Let it be the start of a new chapter where we work collectively to protect and strengthen the prosthetic and orthotic workforce well into the 21st century. I'm immensely optimistic about the path forward and look forward to meaningful reforms that we'll achieve together. Thank you again to the team at the Centre for Biomechanics and Rehabilitation Technologies at Staffordshire University. I'll now hand over to Nachi and the team to present the full details of this insightful report.
Thank you for that, Peter. I would now like to invite my colleagues, Dr. Nicola Edison and Dr. Aoife Healy. Nikki, who led this initiative, will introduce the report and will give us a summary of the findings. Aoife will give us an overview of the methods.
Thank you, Nachi. There are 14 separate allied health professions within NHS England, of which prosthetists and orthotists are the smallest. As of March 2023, there were 1,187 prosthetists and orthotists registered with the Health and Care Professions Council. Prosthetists and orthotists are autonomous clinicians. They use evidence-based practice to provide clinical assessments, prescriptions and technical design of prostheses and orthoses. Prosthetic and orthotic technicians are highly skilled members of the P&O support workforce. They design and manufacture custom-made devices to meet the prescription determined by the prosthetists and orthotists. Prosthetic and orthotic support workers work with the prosthetist and orthotist to deliver patient care under a range of supervisory arrangements. Historically, obtaining comprehensive data on the workforce has been challenging, due to this information being held across different organisations. Reports from various organisations such as NHS England and Scotland, Health Education England and the Centre for Workforce Intelligence have provided limited information on the workforce and highlighted the challenges in sourcing information. A growing concern is the anticipated rise in the demand for P&O services due to the ageing population and the increasing prevalence of non-communicable diseases such as diabetes, coupled with staff retention issues. The 2023 HCPC report on attrition concluded that 12.8% of prosthetists and orthotists, which equates to 1 in 8, had left the HCPC register within 4 years of their first registration. This was the highest rate amongst all the allied health professions on the register. In addition, recent research has identified staffing issues, with 37% of orthotists indicating that they would leave the profession if they could. Understanding the P&O workforce is essential to ensure that it is adequately equipped to meet the evolving needs of our service users, enable us to facilitate informed decision making, resource allocation and strategic planning to ensure that service users receive timely and effective P&O interventions. Therefore, the aim of this project was to generate an overview of the entire UK P&O workforce and P&O service provision. I'll now pass over to my colleague Aoife Healy to discuss the methodology and highlights of this project.
Thanks very much, Nikki. Initially, we conducted a review of currently available data, which included data from the HCPC and the NHS electronic staff record. Following this, we conducted 2 surveys and 2 Freedom of Information requests to gather information on the P&O workforce. The workforce survey was an online survey for the P&O workforce, which was distributed via professional networks and social media. We used a social media campaign and videos from influential members of the profession and stakeholders to encourage participation. The survey asked the P&O workforce to provide information on their demographics, employment and skills, the clinical populations they treat, and their job satisfaction and career goals. The private P&O company survey was sent directly to known stakeholders and via the British Health Trade Association, and the Freedom of Information Act requests were sent directly to the organisations. The private company survey and the Freedom of Information Act requests to the NHS trusts and health boards asked for information on employment of the different P&O staffing groups. This included prosthetists, orthotists, technicians, support workers and apprentices. And it also asked on current vacancies and recruitment within the organisations. The Freedom of Information Act request to the higher education institutes providing P&O programmes asked for information on current student numbers, student demographics, numbers of recent graduates, and the curriculum and capacity of the programmes. As expected, we found that the existing data on the P&O workforce was limited. The available data did not provide information on skills, place of work, current role or career goals, and it also didn't include the wider P&O workforce, technicians and support workers. We had strong responses to our requests for information through the surveys and Freedom of Information requests, which enabled us to gather rich data on the current P&O workforce and the current P&O students and apprentices. Looking at some of the key highlights from the project, we now have for the first time an understanding of the number of people currently employed in the P&O workforce across all sectors. From the workforce survey, we have captured the demographic diversity of the P&O workforce. Prosthetists and orthotists reporting to have a disability is higher than the average across the allied health profession workforce. Those identifying as LGBTQ+ is higher than the national average, and those identifying as transgender is equal to the national average. The P&O workforce is made up of people from 26 different nations who can speak 31 languages. We have identified that the current P&O workforce numbers are below the World Health Organization recommendations. To meet the recommendations, between 142 to 477 more prosthetists and orthotists and 1,133 to 1,803 non-clinicians, that being P&O technicians and support workers, are needed. The responses from the private company survey and the Freedom of Information Act request to NHS trusts and health boards indicated that there were 109 vacancies within the P&O workforce, and that nearly half of the UK NHS trusts and health boards and 57% of private companies who had vacancies reported that they had not been able to recruit. The highest number of vacancies were for orthotists and orthotic technicians. From the workforce survey, a potential workforce attrition concern was identified, with a fifth of prosthetists and orthotists reporting that they definitely do not, or probably do not, plan to remain in the UK P&O workforce for the next 5 years. Also, from the workforce survey data, it was found that almost a third of support workers felt that they did not currently have the skills to carry out their job, and that they could be better utilised and have skills that were not being used. I will now pass back to Nikki to summarise the outcomes of this project.
Thank you, Aoife. This project has allowed us to develop an overview of the current P&O workforce in the UK and has confirmed several issues that were considered to exist within the workforce. We confirm that the current workforce is below the WHO recommended staffing levels, coupled with employers across the public and private sector reporting that they cannot fill vacancies, and a high percentage of the P&O workforce were considering leaving the profession. Whilst this data succinctly identifies the pressures faced by the P&O workforce, additional data derived from this study also provides us with valuable information on the extensive skill range of the P&O workforce, the clinical population the profession cares for, the future plans of the workforce, and the needs and requirements of our future workforce, our students, thus providing us with a fantastic opportunity to address some of the issues we have identified and positively affect change. To conclude, this was the first project to explore the entire UK P&O workforce across all sectors. A limitation was the low response rate to the workforce survey from support workers and technicians, and future initiatives are needed that engage with these staffing groups to gather a complete understanding of their demographics. The findings from this project are consistent with similar projects undertaken by our international colleagues in America and Australia. Therefore, the demand for P&O services is a global issue which may require collaboration on a larger scale. Now back to Nachi for concluding comments.
Thanks for that. And on behalf of the team here at the Centre for Biomechanics and Rehabilitation Technologies at Staffordshire University, I'd like to extend our heartfelt gratitude to each and every one of you who are involved in this incredible journey. I'd especially like to acknowledge the contributions from Enza, Caroline and Bracken, who helped to pull this report together. All stakeholder contributions added immense value to the launch of our report on this prosthetics and orthotics workforce. Your insights, perspectives and contributions have been really invaluable. Together, we have taken a significant step towards a future of enhanced care and inclusivity for those who rely on prosthetic and orthotic solutions. We look forward to continuing our collaboration and shared progress. Thank you once again for being a part of this inspiring journey. Thank you.